Hello and welcome to WVU Medicine Tuesday Talks. I'm your host, Mary Ravazio Menard. The most devastating complication a patient can face after total knee or hip replacement surgery is contracting a prosthetic joint infection, or PJI. PJIs are very difficult to treat, but a new clinical trial at WVU Medicine is raising hopes for a breakthrough in successfully treating these stubborn infections. Today, we're talking with WVU Medicine orthopedic surgeon Dr. Matthew Dietz, one of the first physicians to treat a PJI with a new antimicrobial medication as part of this clinical trial. Welcome to Tuesday Talks, Dr. Dietz.
Thank you, Mary, for having me.
Good to have you here. We encourage you to post any prosthetic joint infection questions you may have in the comment section below, and we'll try to answer them live. Okay, so let's first start with what exactly is a prosthetic joint infection, or PJI?
So prosthetic joint infection is a mouthful. PJI, essentially it's when we have a hip or a knee replacement that gets an infection on the implant and in the surrounding tissues. And unfortunately, it's not like treating an ear infection. When I'm talking to my patients, I'm telling them that it's very much like treating a cancer, that it typically requires multiple surgeries. It can require long courses of antimicrobials, just like chemotherapy. It can be a tremendous burden on the patient, their families, limit their ability to walk, work, and get back to doing the things that they love. And unfortunately, we just don't have a great solution in treating these types of infections.
Why are these infections so hard to get rid of?
Well, there's a number of reasons that we have difficulty in eradicating the infection. And in fact, when you look at our success rate, it's only around 50 to 75%. And so to be honest, when we're talking about the odds being that poor, when we're dealing with a big surgery and a big involved treatment like treating prosthetic joint infection, we can do better. The reasons it's so challenging to treat these infections are several. One is the bacteria becoming more and more resistant to the antibiotics that we use. Also, those bacteria exist in a slime layer. That slime layer sticks to the surface of the implants, the tissues, and it really limits the ability of the antibiotics to get in and attack those bacteria, and it also limits our immune system from fighting that infection as well.
Wow. So, I mean, that's a common problem, too, with the antibiotics just not, losing effectiveness.
So we're seeing increasing resistance to antibiotics across the healthcare community. It's really a growing concern, where those antibiotics that we used to use as our second and third line defenses are now becoming, more and more resistance developed against them. And so it's becoming challenging, where we have to find new and innovative solutions to try and treat these infections.
So more and more people are getting joint replacements, right?
Yeah, I think if you look at overall, total hip and total knee replacements are very successful. And I think that's why you're seeing the increasing demand for this type of surgery, where over the past several years in the United States alone, we see around 800,000 total knee replacements a year, and about 500,000 total hips a year. And so when we're looking at that, that means that we're doing something right. Patients want to stay active. They want to stay mobile. Unfortunately, we know that about 1% of those patients will experience a prosthetic joint infection in any given year. And so when we're talking about such large numbers, that 1% really becomes impactful when we don't have a great treatment or solution for it. And so it's a growing problem in the orthopedic community.
I like to think of the 99% that aren't going to get that infection.
And I think that's important to focus on, that 99% do fantastic. They get back to doing the things that they love. But when you have that 1%, it can have such a devastating effect on them and their families that we need to do better and find a better solution for them.
Okay, good. And here's the thing that I didn't know. And full disclosure, I've had both of my knees replaced, and you've done it, and they were spectacularly uneventful, which is always good. But I didn't know until recently that you could get a PJI. I always thought, oh, that's probably what you're at risk for, like the first month or so after your joint replacement, but it could be, you can get 1 year afterward.
Well, you're right. The greatest risk is in the first 2 years after a total joint replacement, and that risk is around 1% or so. But anytime you have any foreign material that exists in the body, we know that there's a risk for an infection there. Luckily, after that 2-year period, that risk drops dramatically to around 0.1 to 0.3%. It's a much lower risk, but it's a risk that still exists.
Okay, good to know. You did talk a little bit about this, but how exactly does a PJI? I mean, it not only affects the patient, this affects the whole family.
Well, if you think about it, a lot of times the surgeries that's required to treat these infections limit the ability to bear weight on the limb, which means that then you have to rely on someone else to get you to and from an appointment. Lots of times you're dealing with PICC lines or IV antibiotics over the course of 6 weeks. So you need someone else there to provide help and care along the way. So not only are you not able to work or do the things that you want to do, but your family members are burdened. And this can really have an effect on the patient, where we can see depression that can really have an effect on the mental health for the patient, because they get very frustrated when we're dealing with this. It can be quite challenging.
Yeah. Let's talk about this clinical trial. Now, it's called the Logic 1 clinical trial, and it's sponsored by Peptologics. So it's my understanding you're basically fighting these joint infections instead of antibiotics, but with peptides.
That's right. So Peptologics is a company based out of Pittsburgh, and they're doing something really fantastic and innovative, where they're using artificial intelligence to try and discover new and novel treatments for a whole host of different medical problems. In this case, they focused on antimicrobial peptides. So all peptides are a group of proteins that are used to fight infection. They exist in nature, they exist in our own bodies. What they've done is they've tried to optimize a specific peptide. In this case, it's called PLG0206. Very fancy sounding name, but it's a peptide that they've manufactured to have broad spectrum effect against all types of bacteria. So they're not worried about the resistant those bacteria that are resistant to antibiotics. And so our hope is we can have a tremendous effect, not only on the bacteria, but also those biofilm layers that are protecting it.
So the thinking is this PLG0206 can treat the infections that the antibiotics just can't anymore.
That's right. So whenever we're choosing an antibiotic to try and treat an infection, a lot of time it has to be very specific towards that organism. What we know for this specific peptide is it doesn't matter which type of bacteria we're trying to fight. It has a very broad spectrum activity. And what it does is it goes in and tries to not only break up the cell walls of those bacteria or those organisms causing the infection, but also the slime layer that's protecting them. And so if we can break up that biofilm, if we can break up that slime, and we can improve our abilities to eradicate the infection from that local environment.
So how do you use this PLG0206? How is it injected, or is it surgically applied?
So in its current form, we still want to perform a surgery where we want to go and clean out any of the unhealthy tissues within the knee joint is the current clinical trial. We then administer the solution topically, so we wash it over the implants, over the tissues, and let it sit there and work for a period of time. And then we're able to leave it in that joint cavity for a period of time to hopefully have the best effect against those bacteria.
Okay, that makes sense. Is WVU Medicine orthopedics, are you the first in the country, first in the world? I know you're one of the firsts to use this.
So the Logic 1 trial is the first in-human clinical trial for this antimicrobial peptide. Wow. That means that when we use this peptide on one of our patients at WVU Medicine Orthopedics, we were the first in the world to use this solution for the treatment of prosthetic joint infection.
Wow, that's really exciting. And it's happening right here. That's great. I know it's still early, but what kind of results are you seeing so far in the study?
I think the company's doing all the right steps and trying to advance this medication safely, taking the right steps to make sure that we're doing this in a safe manner for the patients, but offering the greatest service. But I think the promising results we're seeing so far are very encouraging, that we see that it's safe. We've advanced the clinical trial to where we're going to an increased dose. We're seeing that the patients are responding well to the treatment. So yeah, it's providing us great hope that hopefully this is a new solution for prosthetic joint infection.
Yeah, because we interviewed one of the patients about a month ago that is taking part in this, and he went hunting like a month or a few weeks after having the surgery with the PLG0206. I have to keep looking at it.
No, you can call it the peptide. And that's our goal, is to get them back to doing what they love. And, the alternative treatment is we have to take everything out of his knee. And then that leaves him without a knee joint for a period of time. And here we're able to hopefully retain the implants that he's had for over 7 years, and hopefully he'll have for the rest of his life. And so we'll monitor him for any signs of recurrent infection. But so far, he's back to hunting, doing the things that he loves, and he's just a great individual.
Oh, yeah. He's fishing too, he told me. Yeah, he's doing great. Do these outcomes that you're seeing, like the gentleman we were just talking about, does this give you hope? Like this could be like a really big breakthrough?
I think it's very exciting. The application of peptides could be a game changer in terms of we're looking for solutions that antibiotics just aren't giving us right now. And it's not only in the orthopedic community, but it's across all of medicine and healthcare. We're seeing that the advancements with artificial intelligence through these processes where they're optimizing these peptides, that we can find novel solutions to hopefully treat such challenging problems like prosthetic joint infection.
And it's good to hear something about artificial intelligence right now that's kind of positive, like, and not so scary, some of the stuff we're hearing right now.
I think it's very positive where we're using it in a rational fashion, that it can go through processes that would take us weeks, months, or even years to try and go through the algorithms to try and find these solutions. And so right now, we're finding some really exciting things with it.
That's great. That's great. Is there what if there's somebody that's watching and who is dealing with a PJI? Is there any way they can sign up for this study?
Sure. We have an expert group of researchers here at WVU Medicine Orthopedics. They're available to talk to patients, to their doctors, to their surgeons, to see if enrolling you or their patients in the Logic 1 trial is a possibility or a solution to hopefully treat that prosthetic joint infection.
Okay. And how long would it take? If all goes well, how long would it take for this to, be approved and be, used on the market?
There's specific processes that the FDA outlines that we want to make sure that we take this through a stepwise approach to make sure, one, it's safe for patients, and then two, that it's efficacious, that it's going to work for the patients that we treat. And so it's still a couple years before it's commercially available, but we're very excited about the results we've seen so far.
That's great. That's great. So would you say cutting-edge clinical trials, first in the world, are just one, like this one is? Is this just one more reason why patients should seek care at WVU Medicine Orthopedics? Don't just take my word for it.
Patients should seek care at WVU Medicine Orthopedics because you have world-class orthopedic care right in your backyard. It's where I would send my family members for care. And in fact, this past year, my wife's grandmother unfortunately had a hip fracture. And she came down here. She had expert surgical care to have her fracture taken care of. She receives high-quality nursing care when she got to the floor. We're able to consult with the anesthesiologist, the internal medicine doctors to help navigate the risk before and after surgery to try and decrease the impact it could have on her. We're able to meet with the bone density specialists to try and prevent fractures in the future. So this whole team approach is not exclusive to Graham. She had a great result, but any patient that's seeking care at WVU Medicine Orthopedics can expect that level of care.
And this is a very experienced team at WVU Medicine Orthopedics. At
the Center for Joint Replacements, we're very fortunate. We're having cutting-edge, comprehensive care. We have a team of surgeons, doctors, nurse practitioners, physician's assistants. We have nurses and staff and researchers that have the knowledge, the talent, and resources that we can provide this great care to our patients. Our goal in most of our patients is to give them a hip or a knee replacement, to get them back to the gym, to get them back to playing with their kids or their grandkids, or even hitting the ski slopes. But if you're part of that unfortunate 1% that gets a prosthetic joint infection, know that we're here to help you through that process. And in fact, we actually have a combined clinic with our orthopedic infectious disease clinic, with our infectious disease colleagues, where we can get together as a group, see you all together at the same location at the same time to provide a comprehensive plan to help you navigate this really challenging process.
Yeah, and everybody's just so nice. I mean, not only, brilliant and spectacular, but just, great care at every level.
I think at every level, everybody takes pride in what we're doing for the Morgantown community and in the state of West Virginia. And we treat each patient like they were our family member. And I think that's what's important. And that's why you see so many people invested in these spectacular outcomes that we're seeing at WVU Medicine.
Yeah, that's great. So, I always like to ask this before we go here. What's the most important thing you want our viewers to know about this Logic 1 clinical trial?
Well, I think the Logic 1 clinical trial highlights a couple things. I think, one, that we know that infection is still a problem, that we're looking for new and novel solutions to offer our patients to provide a better result. I think the logical in trial using PLG-0206 to try and treat these infections with this peptide is a safe way, and I think it's offering us great hope, but still requires further research so that we can continue our collaboration with companies like Peptologics, with our colleagues at the Cleveland Clinic, Mayo Clinic, and Harvard Brigham and Women's Hospital. And so I think on the surface it shows us that we're involved in cutting-edge research. I think under the surface this also shows that the healthcare and research community holds the work that's being done at WVU Medicine Orthopedics in high regards, on par with those premier level institutions.
Yeah, definitely. I'm really excited about this. I hope I never need it, but I mean...
The hope is that you never need it, but I think the important thing known is that we have a great team and that we're looking at great solutions to try and offer those patients.
All right, great. Well, thank you so much for sharing all this. Oh, wait, before we go, we have a question. Sorry. Somebody wanted to know, what are the signs and symptoms of infection?
Yeah, so diagnosing infection can actually be quite challenging. Whenever we're talking to our patients, we want to have a high index of suspicion. So even if you just have a painful joint replacement, sometimes that can be a sign of a low-grade infection. And so it's something important to ask your surgeon about. Other things we'll see is that the joint can become swollen, red. Sometimes we can actually see leakage from the joint or drainage. That's very rare, but it is a possibility. And so if you have a painful joint replacement, a hip or a knee, or something that seems to be giving you problems, it's important to ask your surgeon whether or not you should be investigated for a prosthetic joint infection.
Okay, good to know. All right. So thank you again for the good information, and thank you for being here. I appreciate it.
Thank you.
And that brings us to the end of this edition of Tuesday Talks. If you're looking for more information about joint replacement, visit wvumedicine.org/joint. And join us next week on Tuesday Talks when we'll talk about office-based hand surgery and telemedicine follow-up in hand surgery with WVU Medicine orthopedic surgeon Dr. Shafiq Siraj. I'm Mary Ravazio Menard, and on behalf of Dr. Dietz and everyone at WVU Medicine, thanks for joining us and have a great day.